How to improve the overall rating of pain management. One of the best ways to manage pain without opioids is to teach patients ways to self-manage their own pain. Some suggestions are acupuncture, therapeutic exercises, and osteopathic manipulative therapy. I know the last one may make some of you scratch your heads, but osteopathic manipulative therapy is where a trained doctor gently moves your joints and tissues. Another way to improve pain management is for doctors to be aware of opioid addictions. If they can spot someone who is addicted to their pain medications, they can get them the help they need without prescribing more pain medications and furthering their addictions. How to improve the overall rating of responsiveness of hospital staff. One way to improve the responsiveness of hospital staff is to utilize other hospital staff more effectively. If one department is in need of help, such as too many people called in for kitchen duty, other staff can help give out patients' trays. HUCs, or health unit coordinators, can work with nurses and doctors to assist them with information about patients in order to have them treated more quickly. This is similar to my job as an ER registrar. I have other job functions besides admitting patients, and one of them is to keep doctors and nurses informed about the patient. If the staff knows more about the patient, then they can treat the patient faster. Another way to improve the responsiveness of hospital staff is to identify and empower leaders among the staff. This helps the hospital work more effectively as a team. Ultimately, the more organized and efficient the hospital staff is, the more responsive the staff will be to patient needs. Thank you.